What are number needed to treat, NNT, and number needed to harm, NNH, and why are these relevant in the treatment of osteoporosis?
So number needed to treat and number needed to harm are really important concept in the treatment of every potential disease in which we are preventing an event. So basically, for every preventative medicine, we need to care about number needed to treat and number needed to harm. The very basic concept of these two numbers is the absolute risk reduction. Basically, what are the odds? Let's make an example to make it easy. What are the odds of winning the lottery? Well, the odds are very, very low. But if you want to double it, the odds of winning the lottery, you just need to buy 2 tickets. Will this make it double the risk? Yes, it doubles the risks. But do it really affects the absolute risk? No, it does not. It just slightly increased the absolute risk because the numbers are very big. So that is the concept of the number needed to harm and number needed to treat. It's the required number of patients that you need to treat to cause an event, let's say an adverse event, so that's the number needed to harm, or prevent an event, so that's the number needed to treat. And it is exactly the inverse of the absolute risk reduction. So the most important point for preventative medicine is the absolute risk of the patient. Let's imagine the fracture risk in the context of osteoporosis. So if you have a very high absolute risk of fractures in your patient and you have a relative risk reduction of, let's say, half with a medication, that will be a large absolute risk reduction. And given that the number needed to treat is the inverse of the absolute risk reduction, well, it makes easy to understand that you will need to treat a few patients to prevent an adverse event. On the other side, the adverse events are not related to the absolute risk of fracture. Think about osteonecrosis of the jaw, very rare adverse events, and so you will have a very small absolute risk in those patients, and so your number needed to treat will be very high. When you have the two numbers, you can calculate actually the number needed to treat for net effect, which is basically comparing the number needed to treat and the number needed to harm. And so when you have a very high number needed to harm and a very low number needed to treat, it's very good to treat. It's very good to start a treatment. And when you have a very low number need to harm, so very common adverse events, and not as effective drug or very low risk patients, well, that's the case for not to treat the patients. So this is the balancing between the risks and the adverse events and the of adverse events and the benefit from the treatment, which is also related very importantly to the costs of the treatment. Basically, if you have a very low number needed to treat, you are justified to start a treatment which have a very high costs because you are going to prevent an event in many of the patients treated. On the other side, you're going to prevent the national health system costs based on the fracture, on the hospitalization and mortality.